communication access and access to information from the beginning of COVID-19 pandemic to now the vaccine rollout. And when people want to get the vaccine, the process to schedule, there's no place to request for communication accommodation or any type of accommodation. So that's already a barrier right there from the beginning. There are 1.1 million people who are deaf, hard of hearing, deaf, blind, living here in the state of Arizona. Yes, we have that many people live here in this state who have a hearing loss. So you can just imagine what communication barrier is like. We're wearing a mask. Can't read lips. We can't communicate. That's the first encounter that we face on everyday life. And we're talking about access to information, registration, and getting the vaccine. I can tell you a personal story of mine. I've already received the vaccine. I have got both vaccines because I'm considered a high risk because of my health condition. I can tell you that my first vaccine experience was a chaos. It was at night, and I must have encountered about 12 different people through the entire process. Not one person offered communication in writing. I had nothing. Luckily, my husband was with me. He was able to assist to facilitate the communication. If it wasn't for him, the line would have been longer because I was forced to communication with someone that I couldn't communicate with the mask on. And I want everyone to wear the mask. I want to make that clear. I don't want people to take off their mask to communicate with me, but there are other solutions. And it's really important to recognize that not just our community who are facing barriers, but other people with disability. And we're here, we have experts here who want to offer solutions if we could just be at the table and offer our expertise so that everyone can be fully have access to the information and access to getting the vaccine. So I want to turn over to our next speaker, Dr. Harvey Goodstein. He is the deaf member here in the state of Arizona. I'm going to turn over Dr. Goodstein.
Hi, thank you so much for the opportunity to come and talk about my experiences. And this is something that not just myself, but other friends within the community have been experiencing. There has been a lot of frustration with this drive-through experience with the vaccine sites. Not being able to communicate is very hard. My wife and I both, we always, both of us being deaf, we always bring a pen and paper to be able to communicate. So in time of need, when there is an optimal communication access, we always can fall back on that. Most, I will say, for my wife and I, we have an extreme solid education, and that really helps us in this situation. But not everyone has that privilege and that opportunity. And I really do think that we could provide some type of specific place where interpreters could be available for deaf individuals to be able to do this. And when they go online, maybe it doesn't have to be as frustrating as it was. There was no place to ask for a sign language interpreter. It was very frustrating to try and make phone calls. And then even with the video relay service that we use to make phone calls, it did happen whenever I was trying to register. I had to wait for an hour, and then we got disconnected. And, you know, all of these are barriers for us. And then I had to go back through the process all over again. because they didn't hold our spot in line, right, to be able to call back. And that was extremely frustrating. And so for a 3-hour process on the first day, between myself and my wife, we were able to make an appointment to go through the first time. They said that we would receive an email for our second appointment, and we've never received that. Some of my friends had received it. Another couple had, in fact, received that. The husband did, but the wife didn't. And so there's been a lot of frustration with receiving communication and the phone call system. It's just been a lot of phone calls that have been unanswered. And, you know, we're looking to maybe try and have our doctor support us in some way to be able to get the second vaccine in a more effective way. It's just been a really frustrating experience trying to get ourselves registered for this vaccine. Some people have been able to be successful. For myself, being 76 years old, considered high risk, but some other people have just given up within the deaf community. As we share our stories with one another, these are the things that I'm hearing. And I know that there are some pharmacy centers that have like a special day for people with disabilities to come and sign up to maybe make it easier. I think these are ideas that we could really run with. And like Sherry Collins had just mentioned with the information sharing, it's been really frustrating for me. Dr. Carol Goodstein had talked on video, and some other people had spoken online, but there was no captions. And so I'm looking to gain all this information that everyone else has. And without the captioning, it makes it incredibly difficult. And you know, I want to warn the people that are in positions of powers that lawsuits are lurking without immediate action on these issues. So I think it's very important that we're heard. And as deaf people, communication access is absolutely vital, not to mention individuals that are deaf and blind. You know, that complicates the situation even further. Sorry to just leave all of these negative experiences on the table. I hope and I wish that I had a better story to tell, but I appreciate the opportunity, and I'm going to go ahead and give it back to Sai. Thank you again. And thank you, interpreter.
Thank you, Dr. Goodstein. Thank you, Sherry, for sharing your experiences, sharing your frustrations and the barriers that you experienced with getting the vaccine and with getting or going through the registration process. Next up, I'm going to turn it over to Michelle Thorne. So Michelle Thorne is the founder and CEO of DAMES, which stands for Differently Abled Mothers Empowerment Society. Michelle?
Thank you, Sai, and thank you for the opportunity for me to be here and to speak today. I am the mother of 2 children who've been diagnosed with autism and the founder of DAMES. Our community has been greatly impacted by COVID-19. Many of our parents who have children with autism, Down syndrome, or who are very medically fragile have lived in fear that this virus could potentially be life-threatening for their children. As the vaccine rollout started, we were very hopeful, as we felt like there was an armor being provided, being built around our children. We watched as their therapists, as their respite providers, as their teachers were vaccinated, and we waited for our turn, but we were never called. There is a chink in the armor around our children, and it is us. Us parents, we are making our children vulnerable. Not vaccinating the parents leaves our children at risk. Today, you are going to hear from 2 of my members, and they're going to share their story of how they have felt through COVID and how they're dealing with not being able to be vaccinated through this vaccination rollout. Alyssa Tessing, she will go first. Go ahead and unmute your mic, Alyssa.
Hi, Michelle. Thank you for having me. Thank you, Sai. So as said, my name is Alyssa Tessing. I am a mom of 2 children with disabilities. The plea to get the COVID vaccine is not a selfish motive or a desire to go out more and see movies with friends. This community wants to get the vaccine as a way to protect the lives of our children. My youngest son, Carson, has a rare disease called RYR1 that affects his muscles. Because of this, he is immunity compromised. He has poor lung function and heart issues. Getting COVID in my family is more than losing taste for a couple of weeks. It's a potentially deadly virus that could take the life of my youngest son and leave a mother with the worst heartache imaginable. My husband and I are considered not to be a priority for the vaccine, yet, as you've heard, there's a valid reason for my family, as well as others like us, to receive the vaccine in a prompt manner. During this time of pandemic, our life has changed drastically. Without having immunity to the virus, that won't be changing anytime soon. Once March of 2020 hit, we pulled our kids from school and shifted our life. We've continued to try and make life somewhat normal for Carson, but this truly isn't possible. My husband has been fortunate to work for a small company, so we've been able to keep him isolated. We've completely switched to online schooling for our children. We do online shopping, nothing in person. You can imagine how difficult online schooling is for a 5-year-old in preschool. The largest change to our life is that Carson has only been out of the house a handful of times. We can't risk that others in society take this virus as seriously as we do. We do schooling online. Even our therapists have transitioned to online therapy so they don't spread the virus from other homes to ours. Again, I plead to allow parents of children with disability the ability to get the COVID vaccine, because we aren't asking to go to restaurants, movies. We just want the ability to go to the grocery store, see our families, and even have therapists in our home without the possibility of bringing a deadly virus to our children.
Thank you, Alyssa. The next mother who is going to speak today is Christine Kenzor. Christine, you can go ahead and unmute your mic.
Hi, I'm Christy Kenzor. I'm a social worker, but currently I'm working as a stay-at-home mom. I have 4 kids, one of which has both Down syndrome and autism. My almost 10-year-old daughter, Ayla. Having Down syndrome makes her more susceptible to respiratory illnesses. Last February, in fact, she was hospitalized for low oxygen and ended up testing positive for RSV. She needed high flow oxygen for about 24 hours, and there were moments when the high flow wasn't enough. It wasn't working. And there was talk about putting her on a ventilator. Luckily, she didn't have to be ventilated, and she made it through, but not without the traumatization of her family. In the past, she's had to spend several hours in the ER due to pneumonia. So when I first started learning about COVID-19, I immediately became fearful for Ayla. I don't think that COVID would be kind to her. And in fact, she's basically stayed home since last March. Furthermore, the studies confirm my suspicions. This virus was hitting the Down syndrome community particularly hard, regardless of age. So much so that the CDC added Down syndrome to their list of high-risk conditions. Among groups at higher risk of dying from COVID-19, people with Down syndrome stand out. If infected, they are 5 times more likely to be hospitalized and 10 times more likely to die than the general population. This is an extremely vulnerable group of people, and it's imperative that we prioritize vaccines for people with Down syndrome who are old enough to be vaccinated, as well as their parents and caretakers. Because my daughter is too young for the vaccine, my husband and I should be prioritized because we are her first line of defense. Other states have already allowed eligibility for the disability community, and I am begging for Arizona to do the same. It is the right and ethical thing to do, and time is of the essence. Thank you.
Thank you, Christy, and thank you, Sai, for giving us the opportunity to speak today and to share our stories.
Thank you all. Thank you, three. Thank you, Michelle, Alyssa, and Christine. Your personal stories really underscore the importance of prioritizing parents and non-paid caregivers. They, like your speakers said, they are the first line of defense for children who have fragile medical conditions. So thank you for sharing your stories. I am going to turn it over to Frances Fisher. Frances Fisher is the operations manager at the ARC of Tempe. Frances, please take it away.
Hi, thank you, Sai. I'm Frances Fisher. I am the operations manager of the ARC of Tempe. I'm also a mother of 2 adult children with with disabilities. I do have 2 speakers, one of which could not be here, but Katie will be speaking in just a bit. But I will be speaking on behalf of Sydney Engel. We spoke, and she has autism. She did tell me that she did receive the vaccine, but she had lots of anxiety because she did not know what was going on. There was a fear of the unknown because they did not give her any kind of information of how the receiving line was going to go and how she was going to get her immunization. She was super confused, and when she got into the lot, it said event. So she thought she was in the wrong lot because she was looking for the vaccine. So she finally got the direction correct, and she went into the event lot. When she did get there, she noticed that there was no alternative communication, and there was no visuals. There was a sign that said "roll up your sleeves," but if you are nonverbal or illiterate, how would you know how to roll up your sleeve? It would be nice to have picture visuals, and she just said that there was no comfort in getting her vaccine. She also noticed that no one did talk to her, so it was just okay, here you go, and then move on up. So her anxiety was up. She was it was a negative experience, and I really thanked her because my family, we have not had our immunizations, and my son is nonverbal. So now I know that I would have to prepare my son and have to get the pictures for him of everything that has to happen, because it's not going to be, they don't have any accessibility for any nonverbal or any illiterate people. So I want to thank you. And then I also have Katie here to talk. So Katie Griffith, you are on.
Hello, my name is Katie Griffith, and today I'm representing myself and also my friends with the ARC of Tempe. I have a physical disability that is called spastic quadriplegia cerebral palsy. I also have generalized anxiety disorder. Today, I would like to talk to you about how my life was prior to the vaccination and how my life is now since I've gotten the vaccination, only because I am a volunteer with medically vulnerable children. Before the vaccination, I was living my life in anxiety. I didn't want to go out. My mental health was getting worse. I was depressed every day. I am a very active person, so that is not normal for me. I was doing things online, like music therapy, occupational therapy, and even before the vaccination, I was exposed to a attendant care provider who did have COVID-19 without knowing it, and she was in my home. Now, cerebral palsy affects your breathing, and I don't have full lung capacity and use a wheelchair for my primary mode of transportation to get around. So I was fearful that I would not be able to live a full life, let alone I would die at the age of 34 years old. Since I've gotten the vaccination, when I went to go get the vaccination, there was people that took my story and my words away from me. When I arrived, the nurse had said to my attending care provider and hub provider, she had said, "What's her name?" Immediately, she didn't talk to me. She just spoke to my attending care provider and took my voice away. My voice has been taken away since I was very young, and I haven't been able to show what I really or truly mean as a self-advocate. So therefore, this was very sad. I felt alone, and I didn't feel like I mattered. Also, I had a lot of anxiety about knowing where to go and being on time, since it was a scheduled visit. This again also increased my anxiety. And now I'd like to talk about my friends. I have a friend who has autism. He wrote to Governor Doug Ducey, and Governor Doug Ducey did not respond. This is a person who is mostly nonverbal, but would like to share his story. He wants to be able to go out and be with his friends and family. He wants to go out and do things that he loves and be part of society. Please, I urge you to help all people with disabilities so they can live full lives. Thank you so much for listening to me.
Thank you so much. Thank you, Katie. And thank you, Sai.
So thank you, Francis. Thank you, Cindy, and thank you, Katie. Those were really powerful stories, and I think all three stories underscores like the need for accessible communication for all people with disabilities, and creating materials in accessible ways for everyone to be able to understand and to be able to participate in, not just with the vaccine, but definitely with the vaccine, but generally anything related to important healthcare information, especially during the times of COVID. So next up, I am going to turn it over to Luis Bowden, I apologize. Luis is the Executive Director of the Down Syndrome Network Enrichment Center. Luis?
Good morning and thank you. In addition to being the Executive Director of Down Syndrome Network, I am a mom of a 23-year-old son with Down syndrome. This is my son, Joshua. Down Syndrome Network helps give a voice to individuals with Down syndrome who cannot speak for themselves. My son, Joshua, is nonverbal and needs that help. People with Down syndrome are particularly vulnerable during the COVID pandemic and are facing incredible challenges in all aspects of their daily lives. As Christy mentioned earlier, the Center for Disease Control added Down syndrome to the list of medical conditions because of the increased risk they have. Adults with Down syndrome experience accelerated aging, meaning that in their 40s, they experience certain conditions that are more commonly seen in elderly adults in the general population. It only makes sense that people with Down syndrome receive the vaccine now. Compared to the general population, people with Down syndrome are 2.5 times more susceptible to severe illness and complications from COVID, and are 4 times more likely to die from COVID. Many states are already following the CDC recommendations. Unfortunately, Arizona is not one of them. In a letter from Dr. Dana Ross, the director of the Down Syndrome Clinic at Phoenix Children's Hospital, she says, considering that adults with Down syndrome are at higher risk for severe illness, the Down Syndrome Clinic strongly advocates for those individuals to prioritize to receive the vaccination to protect them from serious illness related to COVID-19. This would be following the existing Arizona priorities to assure those who are most vulnerable have access to receive the COVID vaccine as quickly as possible. We feel it is in line with the principles set forth by Arizona's Vaccine Prioritization Committee, that these principles have been adapted from the National Academies of Sciences and Medicine. In light of all of this documented risk, Down Syndrome Network believes Arizona must prioritize and include people with Down syndrome and at-risk individuals with IDD in phase 1B. Prompt attention to this critical at-risk population will make an impact on stopping the spread of COVID and saving lives. Please don't let our children with Down syndrome or IDD left behind. Thank you.
Thank you, Louise. Thank you for sharing your story, and thank you for sharing the information from the CDC and your research on other states and how those states have incorporated individuals who have Down syndrome into their prioritization. So the Department of Health has not included people with Down syndrome, and it is an imperative that they do. I am going to turn it over to John Myers. John Myers is the Executive Director of the ARC of Arizona, and John will be giving us some closing remarks. So John, take it away.
Thank you, Cy, and thank you to everyone for joining us this morning for this press conference. We appreciate your interest in this issue on behalf of Arizonans with disabilities. We've heard from an array of advocates and self-advocates this morning representing various segments of the Arizona disability community. We've also heard in recent days from the Centers for Disease Control, and from all of them, the message is clear. The Department of Health Services and the governor's office must take immediate steps to protect and meet the needs of Arizonans with disabilities during the vaccination process. We call upon them to prioritize residents with intellectual and developmental disabilities served by the Arizona long-term care system among the very most vulnerable residents of our state, regardless of their age. And while we don't presume to demand that all individuals be vaccinated, we insist that the vaccine be made available to all Altex members who wish to receive it, as well as their caregivers, regardless of where they live. We also call upon the governor and ADHS to ensure that appropriate and necessary accommodations are made available to all individuals with disabilities at vaccination sites, whether those accommodations are to meet communication, mobility, or any other disability-related needs. For too long, the state has ignored the vulnerabilities of people with disabilities. The time has come for ADHS and the governor's office to remedy this situation. The time has come for the disability community to be recognized, respected, and protected by providing vaccine access to all Altex members and their caregivers and the appropriate accommodations that are necessary for all who require them. Thank you again for joining us today, and I'll turn it back over to Sai.
Thank you, John, for those words. So we are going to we are going to have a question and answer session now. So Natalie, correct me if I'm wrong. If you have a question in the chat box, feel free to type your question in the chat box. Otherwise, if you would like to voice your question, please feel free to raise your hand, and one of the moderators will identify you and will unmute you. Thank you.
Hi, I'm Natalie Luna Rose, Communications and Outreach Manager for the Arizona Center for Disability Law. Thank you for joining us today. So yes, if you have a question, please use the hand raise button, which is there in the reactions on the bottom. Thank you, Nick. You put it in the chat. You can also ask questions in the chat, and we've got a few more minutes, so please take the opportunity. Thank you. Okay, we'll start with the first question here from Liliana Salgado. How many requests have been sent to the governor or to ADHS?
So on behalf of our organization, ACDL, we've sent 2 requests. Our first request was on December 14th. That was right around the time the vaccine started to, the Moderna vaccine started to roll out. So December 14th was our first one, and last week we sent a request to Governor Ducey. So 2 just from our organization.
Thank you, Sai. Next question from Kathy at KJazz. What are the next steps if you don't get a response from ADHS or the governor?
Sure. So we hope that the governor's office and the Department of Health will see what a big need this is, what a big ask this. We want the governor's office to see why people with disabilities need prioritization. Like one of the speakers said before, it's not about wanting to go to the movies and wanting to go out. It's about protecting their loved ones. It's about protecting themselves, and it's also about getting equitable treatment at the vaccine sites and getting access to appropriate communication materials in a format that is accessible to them. So we're hoping that the governor's office will see all this information and will realize that there is an imperative need for it. Otherwise, there are a number of options that we are considering. Other states have filed what are called OCR complaints, which are the Office of Civil Rights Complaints. So we're considering that, and we're also considering other options. But I hope the governor's office and the Department of Health moves quickly and expediently, because time is of the essence. These vaccines are necessary, and they're necessary to protect the lives of vulnerable people. So we hope that they move expediently.
All right, thank you. Next question from Stephanie Innes. Are there any states doing a good job at accommodating people with disabilities in terms of vaccine access and prioritization? And could you name a few of those states?
Sure. So a number of states have vaccine prioritization. The first state that pops into my mind is Oregon. So Oregon has people with disabilities included in their state plan a number of times. They made a number of inclusions for specific types of disabilities in their VAPAC akin committee. So Arizona has a committee whose acronym is VAPAC. Oregon has disability rights organizations represented in that committee. So those disability rights organizations are able to advocate on behalf of their communities. So that's something we've also asked the governor's office to do, to include people with, to include disability rights organizations in their planning. And again, to this date, disability rights organizations have not been included, and we haven't received a response.
All right, thank you. Question from Lisa Jasper. My only question is, where is the class action? As far as I'm concerned, the state is using federal funds for high-risk medical and disability cleansing. After many months of advocacy, I'm not mincing words here. The state and the powers that be no longer deserve the benefit of the doubt. I've had to be a professional advocate here since 1979. It's always been like this, but enough is enough. Sue them. And she also writes, just do it. My family doesn't have this kind of time. I've worked hard to keep them alive all these years.
Yeah, sure. So lawsuits are always an option, and lawsuits are always a consideration, but we want to build this bridge with the Department of Health and with the governor's office first. We want to create a collaborative environment that will include all the relevant stakeholders. Lawsuits are tricky because they don't always get immediate results. Lawsuits can take time, and time that we could use to identify ways to help people with disabilities. So lawsuits often take a long time to process and to go through.
Okay. And Betty or Sherry, do either of you have a comment to make on what states are doing this right?
Can you repeat the question? The interpreter switched at the same time. I missed.
Oh,
I just heard my name.
That's fine. So are there any states doing a good job at accommodating people with disabilities? And could you name a few of those states?
Yeah, there are several that I can think of right away. Maryland, I'm talking about from the beginning of COVID-19 to current vaccine. Of course, different states have the different, schedule of vaccine of age. But Maryland is one that I can think of. Utah has some good collaboration with their Department of Health. Michigan, North Carolina. I mean, there's just several of those that I can think of right away. And making sure that communication is providing an interpreter on site through the app of the BRI or person on site. So, and Oregon is one. So there's several who are doing really well in that area.
Christy adds, Oregon and California have prioritized people with disabilities and their parents and caretakers.
Yeah, correct.
Thank you, Sherry. A question from Liliana Salgado. Do you happen to have specific data, the size of the special needs community in Arizona versus those that have not been vaccinated?
So I hate to put him on the spot, but John, if you have statistics that you can point to, could you answer that question?
Yes. Generally speaking, we're talking about the population of individuals who are above the age of 16. If we're talking about Altex members, we are roughly speaking talking about around 13,000 individuals who would be eligible for, who fall under the category of Altex members, but are not eligible to receive the service because of where they live primarily. As you probably know, individuals who are served by DDD and Altex who live in group homes, DDD licensed group homes, have been eligible to receive the vaccine for several months. But those who live outside of group homes, who may have identical diagnoses to those living in group homes, have not been able to get the vaccine because they, because they live in the community. And so we're talking about, again, in general terms, about 13,000 people who are Altex members across the state who we believe should be able to get the vaccine immediately.
Thank you, John. Any other questions as we wrap up? Okay, I'm not seeing any. Sai, any final words?
Just that we thank you for your time, and we thank you, and thank you to our speakers today, and for sharing your stories. Those were really powerful stories, and they show that there is a need for communication and dialogue between disability rights organizations and the Department of Health and the Governor's Office. So again, thank you all for coming today, and thank you all for letting us share our stories about the inequitable distribution of the vaccine.
And Sai, if there's people have follow-up questions, who can they contact? Will you be the contact?
Yeah, you can contact me. You can email me, and we can exchange messages on email, or we can set up a time to talk. If I don't know the answer, or if there is a better person who is better suited to answer the question, I will forward your email to that individual.
And I just put Sai's email in the chat, as well as mine, for follow-up as well. So I have no more questions. I do believe this concludes our press conference for today. So thank you for coming. The team that met before we opened the press conference, if you could stay on so we could chat a bit, that would be appreciated. Again, thank you, and have a good day, everybody.
Recording stopped.